Okay, so secondary insurance, because I just had a little issue, so I figured let me just talk about it really quick. How secondary works is well, first of all, there's a certain way that we have to process the claims, right? So I have to bill your primary first, whether I accept it or not. Get the explanation of benefits from your primary, and then I have to submit that to your secondary for them to pay on your deductibles, co-pays, and co-insurance. It is not double dipping. It does not work as adding extra money to something. It's just, it doesn't work like that. I don't know who taught you guys that. When you have secondary, yes, it's very beneficial, and there are some of you who end up getting a full reimbursement back, excuse me, which is great. But there are a lot of times where no, you do not. You are not getting a reimbursement back. Rules still apply with secondary. Deductibles, co-pays, co-insurance, like I just said. So imagine it's just like a new insurance that I'm billing second to pick up what your primary did not. That doesn't mean that you're getting a full reimbursement back and I'm giving you a full check back. That is just not how it works. And the office has to bill this correctly. Has to be billed correctly in order for it to go quick. Predetermination is going to take a little bit longer because remember, I have to send in for your primary. They have to let me know what they're going to pay, whether they're paying nothing or not. I then, like I said, have to submit it to your secondary. Secondary will then let me know what they're going to pay. At that point, yes, we, the office, can give you what your copay is going to be without a doubt. You know, you can kind of hold it to us as long as nothing happens in between, because insurance companies have told us what you are to pay and what they're going to pay us, and everything equals out. But if you're choosing not to wait for the predetermination, you're going to have to pay. There's going to be something that you're going to have to pay. I don't know what your secondary insurance is going to say. I cannot rely on that coverage. But remember, you have 50% coverage, let's say for major. So your secondary is only going to pick up 50% of that procedure, if they are. There's also rules that they don't let you know, like in the office. What we see is if your secondary has a lower or higher fee, that makes a difference. So if your primary insurance pays more, your secondary might not pay anything. So there are many things that you have to ask when you're looking into secondary. Do not look at it as a way of having extra money per se for a treatment that you may need. Do not go out and buy individual secondary insurances without this knowledge. Okay, there's going to be missing tooth clauses, wait periods if they apply, deductibles, maximums. You want to know the percentages, wait periods, missing tooth clauses, all of that, especially for implants, because I know a lot of implant cases you guys want to pick up a secondary insurance. Just remember that they are great. Yes, I'm not saying they're not beneficial, but there can also be circumstances where they end up kind of screwing you. And remember, the office that you're at has to be billing it correctly. But we cannot bill it correctly if you guys do not give us the proper information. Whether we accept the insurance or not, you still have to give it to us. It's still something that we need, because the secondary that I'm billing is probably the one that I participate with, but I'm still going to need that denial from your primary. You might get it before I get it. So there has to always be communication between the office and the patient. Dental is very personal. It's very personal, from the billing all the way to the cleanings to the dentists. I hope this helped on secondary. I hope you don't go in this thinking that you're going to have to pay nothing for treatment that is needed. You might have to pay something. So don't get mad at your office. Just make sure you're asking these questions before purchasing a secondary plan. And as far as people that are married, I know a lot of patients that they choose not to have a secondary plan. So they don't want the insurance to come out of their paychecks. One insurance is good enough for them. So you guys also have to start doing the math on that. Hope this helps. And I have no idea what I'm going to talk about next. We'll talk about the next problem. Have a fantastic day, and please subscribe to my YouTube channel. Thank you.